Welcome to this video series, and this will be the first video in this series of videos on opioid analgesics. In this particular discussion, we will try to clarify the mechanism of action of opioid analgesics. To understand the role of opioid analgesics, an idea is required regarding the concept of general anesthetic agents. The state of general anesthesia is said to be achieved when 5 components are present, and they include amnesia, immobility, decrease in autonomic reflexes in response to pain, analgesia, and loss of consciousness. It is true that all 5 of these components can be produced in a patient using a single general anesthetic agent. However, very high doses of that general anesthetic agent would be required, and this would lead to profound hemodynamic depression. To achieve all the components of general anesthesia state without producing excessive hemodynamic suppression, a combination of drugs are used instead of a single general anesthetic agent. So, we would combine the general anesthetic agent with a neuromuscular blocking agent, with opioid analgesics and other drugs, and this would produce the state of general anesthesia that we require. Now, in this video, we will discuss how pain is normally perceived, how the intensity of pain impulses are normally regulated endogenously, how opioid agents make use of the endogenous systems to produce profound analgesia. This should prepare us to understand how opioid agents work. So, how is pain normally perceived? We know that the human body contains pain receptors, and these pain receptors sense painful stimuli. These signals are transmitted by first order neurons to the spinal cord, and these first order neurons terminate in the spinal cord. Second order neurons emerge, and these second order neurons synapse with the first order neurons, and they cross the midline. The second order neurons cross the midline. So this is how it goes. So this is the first order neuron, and it continues to the spinal cord, where it terminates on the same side of the spinal cord. Second order neurons emerge, and they cross the midline and enter the opposite side. Now from there, the second order neuron will ascend the spinal cord. So this is obviously a cut section of the spinal cord, so you would have to imagine the second order neuron to come out of the screen towards your face. This is how it would ascend up the spinal cord. So in this way, the second order neuron reaches the higher centers of the brain, and ultimately pain is perceived. This is the ascending pain pathway. The junction between the first order neuron and the second order neuron in the ascending pain pathway is important to understand. So let's enlarge this particular part of that diagram. So here, as you can see, we have the first order neuron of the ascending pain pathway, and to your right hand side there is the second order neuron of the ascending pain pathway. Upon stimulation, the first order neuron releases neurotransmitters, which you can see in the diagram. The first order neuron of the ascending pain pathway has got voltage sensitive calcium channels. When these calcium channels are stimulated, the neurotransmitter gets released. It is also worth remembering that the second order neuron of the ascending pain pathway has got potassium channels. And when these channels open, potassium enters the second order neurons, causing hyperpolarization and deactivation of the second order neuron of the ascending pain pathway. So these are certain points that are worth remembering before proceeding. Right. So we had a very rudimentary discussion on how pain is normally perceived. Now let us try and understand how the intensity of pain impulses are normally regulated endogenously. So we need to know that there is a descending pain modulating pathway, also called the endogenous analgesia system. So this neuronal pathway decreases the activity of the ascending pain pathway. So this pathway starts in the higher centers of the brain, particularly the periaqueductal gray. So the first order neurons emerge from the periaqueductal gray and descend to lower structures of the brain, and these first order neurons terminate at the lower structures of the brain. Second order neurons emerge and they descend down the spinal cord and terminate. They terminate at the junction between the first order neuron of the ascending pain pathway and the second order neuron of the ascending pain pathway. So this is how it goes. So there's the second order neuron in blue, the second order neuron of the descending pain modulating pathway. Now, these second order neurons of the descending pain modulating pathway releases a neurotransmitter. This neurotransmitter is an endogenous opioid. It is present physiologically. This endogenous opioid is called enkephalin. Enkephalin will bind to its receptors. These are opioid receptors. So opioid receptors are present on the first order neuron of the ascending pain pathway and the second order neuron of the ascending pain pathway. So coming back to this diagram, the second order neuron of the descending pain modulating pathway will release enkephalins, and this will bind to the opioid receptors present on the first order neuron and second order neuron of the ascending pain pathways. When enkephalin binds to the opioid receptor present on the first order neuron of the ascending pain pathway, it inhibits the entry of calcium via voltage sensitive calcium channels and thereby prevents the release of neurotransmitters from the first order neuron of the ascending pain pathway. Enkephalins also bind to the opioid receptors present on the second order neuron of the ascending pain pathway and thereby open the potassium channel seen on the second order neuron of the ascending pain pathway. This causes hyperpolarization and effectively deactivates that neuron. The end result is failure of conduction of pain impulses from the first order neuron of the ascending pain pathway to the second order neuron of the ascending pain pathway. Now this is known as the descending pain modulating pathway or the endogenous analgesic system. Now, under normal physiological conditions, the descending pain modulating pathway is under constant inhibition by GABA neurons. So these are the GABA neurons and they constantly or constitutively inhibit the descending pain modulating pathway. Okay, so what happens if we administer an opioid analgesic? What happens when we administer an exogenous opioid analgesic? Right. So when we pharmacologically administer an opioid, this drug will exert its effects both at the supraspinal level and the spinal level. So when we administer an opioid analgesic, it will inhibit the GABA neurons, which means that the GABA neurons can no longer inhibit the neurons of the periaqueductal gray. The descending pain modulating pathway will get activated, and this ultimately results in the failure of pain signals to get transmitted from the first order neuron of the ascending pain pathway to the second order neuron of the ascending pain pathway, resulting in powerful analgesia. In other words, pharmacologically administered opioids will cause the activation of the descending pain modulatory system. So this explains the mechanism of action of pharmacologically administered opioids at the supraspinal level. Now, how do opioids work at the spinal level? When we administer an opioid analgesic, it can bind to the opioid receptors present on the first order neuron of the ascending pain pathway and the second order neuron of the ascending pain pathway. And as we explained earlier, this will result in the inhibition of the voltage sensitive calcium channels in the presynaptic neuron or the first order neuron of the ascending pain pathway. It will also result in the opening of potassium channels on the second order neuron of the ascending pain pathway. And the ultimate result is failure of conduction of pain impulses from the first order neuron of the ascending pain pathway to the second order neuron of the ascending pain pathway. So when we talk about the mechanism of action of opioids, and when we say that it acts at both the supraspinal level and at the spinal level, this is what we actually mean. We shall continue this discussion in the next video.